PTSD or post-traumatic stress disorder is a psychiatric illness which happens after exposure to a very violent and traumatic event. This could be in the form of an exposure through a war, a natural disaster such as an earthquake, famines, or even as a result of sexual assault. In this disorder, individuals develop symptoms such as a marked intrusive images and recollection memories of the traumatic event, where they might experience sudden vivid flashbacks as if it is happening in real again and again. It might happen in dreams. As a result of this, they develop a very hyperarousal symptom because of which they are extremely hypervigilant and fidgety. They get startled on listening to a very light sound. They can get very irritable and angry at times. They develop a lot of avoidance behavior as well, where they avoid places and situations that had triggered that traumatic event, or even sometimes recollection and discussing of that traumatic event as well. As a consequence of PTSD, they also develop a negative pattern of cognition and thinking and looking at the world, where they might start feeling that the world is a very dangerous place, people cannot be trusted, and things can go wrong very quickly, which might impair their ability to make relationships and go through normal day-to-day activities as well. When we talk of causes of PTSD, anyone who is exposed to a very traumatic event can experience PTSD. Although it's very important that in today's world, even virtual exposure, such as looking at violent images or videos which are rampantly available on the internet, can also trigger PTSD in an individual. When we talk of treatment, it basically involves trauma-focused and trauma-informed therapy, EMDR, something called as eye movement desensitization and reprocessing, which helps them in reprocessing through this traumatic memory in a very safe and conducive environment. Art therapy, virtual simulation, so that they are able to process through that traumatic event again. And medicines, which can help in dealing with the emotional problems that come as a consequence of the illness.